We try to understand why children who have diarrhea, which is the second leading cause of death in low and middle income countries. So, roughly 500,000 children die of diarrhea. And we wanted to figure out why that is happening. There is a cheap or an inexpensive but really effective treatment available called ORS. But despite this treatment being available, a lot of doctors or healthcare providers don't prescribe this to their patients. And as a result, these children are dying. We had kind of three potential explanations for this. The first was maybe ORS is just not available. It's cheap, so maybe, physicians stock the more expensive, more lucrative medicines and not ORS. The second was because ORS is cheap and, say, antibiotics are more expensive and more profitable, if the physicians are prescribing or dispensing antibiotics instead of ORS. So there's a financial incentive at play. And the third was, ORS is not like a traditional pill. It's not a medicine or it's not an injection. It's actually a powder that you mix with water. So there could be this perception that the patients don't want ORS or don't think about ORS as real medicine. And these physicians or healthcare providers are in private practice. So they're trying to, get their patients to come to them and impress their patients. And they might think that prescribing ORS, which patients don't want, maybe they'll lose their patient, right? So there were these three kind of explanations. And what we found was, surprisingly, that the thing that matters the most in terms of why physicians don't prescribe ORS is that physicians think, or healthcare providers think, that patients don't want ORS. And the second surprising thing is that when we actually surveyed the patients, they didn't hold this view. So the patients actually were fine with ORS, but the physicians thought that they didn't want ORS. And one of the ways kind of physicians figure out, whether a patient wants something or not is, when a patient asks for a treatment. So what we found that, a minority of patients, only about 16 to 18% of patients asked for ORS. And that's why physicians had this view that patients don't want ORS. But when you actually ask them an open-ended question that do you think ORS is a good treatment, the majority of patients actually agreed with that statement. So I think that's the surprising finding from this research.